Good morning, everyone. Welcome back to Banda Global Forum. I'm your host, Dr. Banda Khalifa. On this platform, we assemble the world's sharpest minds in health, leadership, and education, where they speak unfiltered, no sound bites. So today we are going to have a real conversation that would enhance your academic journey. Often when people talk about graduate school, especially the ones I've encountered with, a couple of them, I would say majority of them, the conversation often defaults to the United States. But some of the most exceptional programs shaping global health today are outside of the US. And one of those institutions is the London School of Hygiene and Tropical Medicine. I mean, I've had classmates, at least I have two classmates from medical school who attended the London School of Hygiene and Tropical Medicine, and we often get into an argument as to which program is better. But I can say that London School of Hygiene and Tropical Medicine is one of the top ranked programs, consistently ranked the top two or top three in public health. So today we are joined by one of the leaders driving that excellence, Professor Ahmed Rashid. He's a pro-director of education at the London School of Hygiene. He's a physician, he's an educator, and an international authority on medical education. Professor Rashid oversees the school's entire academic portfolio, including strategies that qualify, including the strategy and quality of his master's and doctoral programs. He has also served in leadership roles at the University College of London, led national medical licensing examinations in the UK, and his research explores global politics and pedagogy of health education. So, in this episode, we are going to look into the graduate programs. I know that is what most of you are interested in, what they offer, what makes applicants stand out, and what funding options exist for students around the world. So, without much wasting lots of time, I'd like to invite our guest to the forum. Professor Rashid, thank you so much for joining us. It's a pleasure having you.
Well, thank you for the invitation. I very much look forward to our conversation.
Awesome, awesome. So I typically like to start off with more of an academic journey or a professional journey. Could you share a bit about your academic journey and what led you into medical education and public health in general?
Yeah, sure. So my background, as you said, is in medicine. So I went to medical school. In the UK, we attend medical school immediately after high school. So I was 18, age 18, as we are in the UK when we enter university, and went directly into medical school. Following medical school, my first passion was actually in cardiology.
Mm-hmm.
And I was due to start a career in cardiology, but actually, when I begun my residency training, I undertook a, a fellowship at the University of Cambridge, which ended up lasting for 5 years. And in that time, I became much more interested in cardiovascular epidemiology rather than cardiology practice, and found myself based then in the Institute of Public Health for my next job, and completing an academic residency program in family medicine and public health. Following that, it was the education part of those roles. So being really closely involved in the undergraduate education program at the University of Cambridge, that really led me to develop a career in medical education. I then did my PhD in medical education at University College London, and took on a role as Professor and Vice Dean there at University College London before I moved over to the London School of Hygiene and Tropical Medicine. So that's kind of a very, very quick summary of my career.
Yes, thank you so much for summarizing such an extensive experience. I mean, when I was reading through your profile, I was really amazed. You've done so much for the medical community and also for public health in general. But I want us to look at your role as a pro director of education. So, when someone says pro director of education, what are like your core responsibilities, and how do they shape the student experience at London School of Hygiene?
Sure. So at the London School, we have a director. So the leader of the London School is called the director. So in other places that might be called the president or the vice chancellor, but we call it the title here is director. So as pro-director education, I am immediately responsible to the director for all matters on education. So my counterpart is the pro-director research. So there are the two of us that work directly to the director to oversee kind of strategy and policy and sit on the executive team of the university. So as pro-director education, I take responsibility for all matters relating to education right across the school. So that includes in all of our different faculties. And it includes not only looking after our existing programs, but undertaking work to consider how we can improve our portfolio, expand our portfolio, and really to kind of meet the school's mission. So the mission of the London School of Hygiene and Tropical Medicine is to improve health and health equity around the world. So constantly we're asking the question, how can our education and indeed our research meet this mission? What more can we be doing? How can we improve the quality of what we're doing in order to meet that mission?
Awesome, awesome. I mean, you seem that seems to be a very extensive portfolio if you have to overlook the educational curriculum for the entire school. But what specific initiatives or innovative ways are you currently most excited about within the educational strategy?
So, I mean, firstly, just to say, I am very fortunate to have an excellent team working with me. So, as though, although I'm pro-director, I have an entire education leadership team who help to realize these goals. So, we have, for example, a dean of students who looks specifically at the student experience. We also have associate deans for education in all of our faculties. So I help to oversee the associate dean's education who look after the programs in each of their own faculties, for example. So I don't want to make it out as though I alone can do
Uh-huh.
the entire piece.
Yes.
Obviously, as with anything, it relies on a really big team to be able to do that. But you asked what the current initiatives are. So we're really interested in how we can enhance health education and particularly public health education, both directly through the students that we are training, but also how we can impact education in indirect ways. And I think that's particularly important as the kind of challenges that we face become so much more local in many ways. And therefore,
Mm-hmm.
although it's important that people will always have the opportunity to come to London and to spend time training with us. And of course, there are opportunities for people to train with us online as well through distance learning options. But really, we also see a value in helping to support education in other contexts around the world. So, for example, through forming partnerships
Mm-hmm.
that enable us to build capacity and also to provide kind of new and innovative ways of training public health workforce of the future.
Okay. So, I mean, in your experience, what trends or emerging topics in global health education do you feel future or prospective students should be paying attention to?
So I think it's always important to think when we think about training, we to think about the workforce and the careers that people are going to be heading into. So of
Mm-hmm.
course, what we really want to do is to train people who are going to be really effective practitioners. They're going to be really effective scholars, researchers, leaders, managers. And professionals as they go into the workforce. So I think it's vital that we consider education in the context of that career and workforce challenge. And I think it's really clear that the kind of work that's going to be happening in public health and global health in the future is evolving as the challenges evolve, as technologies evolve,
Mm-hmm.
and therefore the training needs to give that set of skills that enables those students to really become effective practitioners and really leaders. I think the emphasis on leadership is really important in
Mm-hmm.
the kind of times we're facing.
Yeah.
We I think all need to think about what those skills are for leadership. Some of the skills, of course, are technical skills, but there are also what you might call non-technical skills or soft skills,
Mm-hmm.
and those are actually, I think, going to become increasingly important as well. So communication and negotiation and advocacy and all of these skills that I think are not so easy to quantify, but actually critically important for the success of these people when they enter these careers.
Yes, and I think you make a very important point about the issue of having the human factor, because I think when it comes to technical knowledge alone, as you've rightly said, emerging technology would one day make those core technical skills less desirable, because you have to also develop the other essential skills as you've highlighted. But I want us to look at the graduate admission process and students' application. Most of my followers or my community is made up of international students and scholars. Um, so I want to find out what qualities do you typically look at for an applicant who applies to the London School of Hygiene and Tropical Medicine in general.
So, of course, we have the requirements that are set out in terms of uh, kind of core academic qualifications and the kind of English language requirements, and those are set out for each course on our website. But I think what I would really like to emphasize is that there is no normal applicant or there is no typical student. It just doesn't exist. You can imagine
Yes.
that in a place like ours, we literally have people who are from all different backgrounds, who are from all different ages, contexts, professions, countries, regions of the world. In some courses, in some universities, they are very focused on one country or one region, or they're
Mm-hmm.
very focused on a particular type of students, and you can set out an archetype that the student will probably be this age, probably be from this part of the world, probably have this background. We definitely cannot do that here,
Mm-hmm.
because our students are really from every part of the world, and that is one of the really unique features of this school. We have students from Africa, from Asia, from South America, from Europe, from North America, from I'm not exaggerating when I say that it's truly global. I know that
Yes.
often people say global and they mean from one country, or from two or three countries. But actually, when you look on our website, we have some really nice graphs and some really nice world maps which show the spread of where our students are and our
Mm-hmm.
alumni are from, and you'll see that it's truly a very vast spread. But it's not just about the geographical spread; it's also about the career stage.
Mm-hmm.
So some of our students are in their early 20s. They're fresh graduates. They've just come out from completing their first degree, whereas others are kind of mid-career. They've done 10, 15, 20 years in the workforce, and sometimes they are wanting to advance the skills that they've got and to develop in their own field, and sometimes they're looking to pivot and actually to shift in their career or in their work, in a different direction. For example, more towards health or towards public health. So that career stage, there's a lot of diversity, and also the professional backgrounds. So of course we're a school of hygiene and tropical medicine, so there's a kind of an expectation that our students will be doctors or nurses, and of course some of them are, many of them are, but actually many of our students are social science graduates, humanities graduates, and are interested, economics graduates from all
Mm-hmm.
different disciplines who are interested in health and interested in taking that more of a systems wide view or population view or public health view, to the kind of big global challenges that we're facing. So I think the key thing is really to say we're very welcoming to people from a really wide variety of contexts, and the qualities that we're looking for are really a passion and an interest in the mission that we have as a school, which is to improve health and health equity around the world. That is the key thing that we're looking for. And outside of that, actually, I know that there's as you quite rightly said at the start, we come all the way, towards the top of the rankings in the world, in terms of public health. So there is sometimes a misconception that we are looking for only the super brightest people or the
Yeah.
most academically gifted people in the world. But actually, that's not the case at all. We're really very open when it comes to what we're looking for in applicants to our programs.
Okay, but I mean, have you had? I think you've highlighted one misconception that probably is only people at the top academically or professionally who can apply. But are there any other common gaps or misconceptions that you see among applicants, especially international students?
So I think there is I guess the often the misconception is that you have to have done a specific set of training beforehand, basically. So there's often a feeling that there are prerequisites to study, and often what we find is that when students speak to the admissions team or when they speak to the directors of the programs that they're interested in, there's actually much greater flexibility than they'd anticipated. And often we have notes on our pages, which are basically advisory notes to say some of the things you may have done in the past that may be relevant previous experience or study to in these programs are kind of listed. But of course, because of the limitations of having these websites and the limitations of kind of succinctness, we're not able to give an exhaustive list. And often when people come with their own specific circumstances, they're surprised to see how accommodating those teams are
Mm-hmm.
to actually recognize that when we talk about experience, when we talk about backgrounds, there are so many different ways that you can demonstrate that.
Okay, so I want you to kind of highlight some of the most popular, I would say, programs that international students typically apply to. I know like MPH is one of the most common ones. Are there any other programs that international students typically apply to?
Yeah, sure. So, although as you say, we have a very big MPH program. I think it's the biggest in Europe. I believe, and there are also variations of that program. So you can study public health with us, but you can also study public health for global practice, which is
Okay.
a separate program which is much more focused on development, and it's much more focused on students who are coming from low middle income countries, for example. We also have a specific public health masters for eye care, because we have an
Mm,
international center for eye care. So people who are very interested in eye disease, and often people who have a background in eye care can come. So I won't list all of them, but there's a not only is there public health, but there are many flavors, if you like, of public health that you can do. But we also have a whole suite of programs which are much more about the quantitative sciences.
okay.
So we have big programs in epidemiology and health data science, medical statistics. So these are much more, focused on data and students who want to kind of become data scientists. But then there are also some really interesting courses which are focused on some of the big challenges that we're facing. So, for example, we have programs in climate change and planetary health, which is one of our newest master's programs, and a relatively new program in One Health. So again, this is thinking about
Mm-hmm.
health through a slightly different lens,
Yeah.
which we run in conjunction with the Royal Veterinary College in London, a very prestigious veterinary school here in London, and some of the modules are shared by them. And another kind of relatively new program that we have is about health and humanitarian crises. So again, this is a very specific program, a specialized program for people who are interested in humanitarian care. And then finally, we have a whole suite of programs for infectious diseases. So given that we're a
Mm-hmm.
school of tropical medicine, you might imagine we teach microbiology, we teach parasitology, we teach entomology, we teach all of the range of disciplines linked to infectious and tropical diseases. And one of our flagship courses is actually a diploma in tropical medicine and hygiene. So this is a professional diploma that doctors often do before they travel to work in low resource settings, or often
Okay.
when they are developing their own careers in infectious diseases. So I've not listed them all there, but just to give you a
Yeah.
flavor of some of the different courses that are available.
Mm-hmm, mm-hmm. Thank you so much for highlighting those. So I'll suggest that so there's so at the master's level you've highlighted most of the courses. At the PhD level too, I presume there are similar tracks. Is there often people ask me, is London School of Hygiene and Tropical Medicine offering a DRPH or a Doctor of Public Health? Are you thinking of starting one, or have you started one already? And how is that going?
Yes, we have, is the answer. We have a DRPH program, and actually, it's one of the oldest ones. So it's been around for some time.
Mm-hmm.
It's I think, a really strong program that allows professionals who are interested in gaining their kind of skills in a much more in a much more flexible way that's focused on the kind of skills they require for the often the management and leadership roles that they're in.
Yeah.
And absolutely, that program, I think, is has a really important role in the kind of in the portfolio that we have, and we see it as a really valuable addition to the training that we can provide, I think it offers something unique compared to our graduate programs, compared to our master's programs and the more traditional PhD route.
Okay. All right. Thank you. It's good to know that. Um, I think one other thing is that, I mean, for international students, most of the time it comes down to funding opportunities and support. So, could you kind of walk us through the type of funding or scholarships that are available for prospective students, especially at at the master's level? Because I'm sure maybe at the PhD level, you may have some form of guaranteed funding for everyone. But if you can walk us through the funding packages or opportunities that are available there.
Yeah, sure. So, I mean, I think the first thing to say is coming back to our mission. The mission of the school is really important, and it's kind of embedded in every decision that we take. And what we want to do is to drive improvements in health and health equity around the world. And because of that mission, we reinvest income that the school gets back into our own scholarships program, and that's something that's been a really clear strategic direction for many years from the leadership of the school. So, broadly speaking, the kind of support that's available for MSc students is those scholarships and awards which are funded by the school and those which are funded externally. And again, I won't go through them all in detail, but you can
Mm-hmm.
see on the website, and I'm very happy to give the links to that we have a whole range of support. Now, some of those support options are limited to certain programs. Some are limited to certain regions of the world. Some are limited to certain types of students. So it's really important that students, potential students, go and have a look for themselves to see what is relevant, in terms of the study that they wish to do. So those are kind of scholarships that you can apply for from the outset. And then, of course, we also have funding support available, for example, to help some of our master students to travel to complete their projects overseas. So
Mm-hmm.
there's
Yeah.
a separate, there's separate funding streams that are available. The research projects that students do in their masters are really important. The research intensive environment here means that students have a great opportunity to do a research project that will really set them up, regardless of whether they carry on to do a research career or a different career, but really to give them the skills to understand the importance of research in public health. So I think the key thing is that we really recognize that scholarships and funding support is important, given the students that we have, and the fact that many of the students who would benefit most from training with us are from low middle income countries.
Awesome, awesome. But before we go, we all know what's happening in the global health space or in the public health space. A lot of people reach out to me. They are worried. They are concerned. What's the future of public health? Is it worth doing a public health degree at this point? For such students, what would be your word of advice to them or anyone contemplating or the future of public health or global health in
No,
general?
sure. No, look, there's no point in burying our head in the sands. We can see what's going on. I think it's clear to everyone, as you say, that this is a really challenging time. In these challenging times, I think it's more important than ever that we have people who are leaders and people who are trained in public health that who can advocate for and who can be leaders of change for the generation to come. Political winds change. Again, students of history will see that that it's not unusual for politics to drive this way and the other. But we know that when people are thinking about what they would like to do with their lives, what legacy they'd like to leave, what they
Hmm.
would like to pursue as a career that will be entitled, that will be rewarding and that would be satisfying, then public health is absolutely has been a wonderful career for so many people, and they can see so many I think champions and so many heroes who have really, without kind of being hyperbolic, who have changed the world through the work that they've done, and those times will come again.
Hmm.
So
Yeah.
I think what's really important is thinking in both in the big picture, but also thinking in the long term. Hopefully those students will have a long and rich career, and the political winds will change time and again in that period of time across their careers. So having that long-term view of what it is that they would like to achieve with their careers, I think, is really important. And I think the other thing to say is, yes, of course, the training is coming back to what we said earlier about the technical skills. Of course, it's important that the technical skills are critical to your training, and that's central to the decisions that you take. But actually, the passion that you have, the goals that you have, the
Hmm.
dreams that you have, the aspirations for a better community, a better population health, a better health for the world is really important to carry through with you. And I think my advice to those students would be, to yes, absolutely get the training, get the skills that you need, but keep always that passion and those goals at the front of your mind so that you can see that actually you're getting these skills in order to enable you to really make those changes that you dream of.
Well, thank you so much for those encouraging words. Uh, before we end, any last words to prospective students, alumni in general? Because I know one of my mates is going to it will be watching this. Any last words for your alumni and all prospective applicants?
Yeah, I mean, I'm really pleased that you raised the alumni because every school in the world thinks that it has the best alumni, but we know at the London School of Hygiene and Tropical Medicine we truly have the best alumni in the world. And I say that to you because I have had the great privilege of meeting so many of them and seeing the amazing work that they're doing around the world. And every time I speak to any of our alumni, I am so inspired by what they're doing and the work that they're leading around the world. And that includes, of course, Dr. Tedros at the World Health Organization, who's an alumnus of the school, and many health ministers who I've met who have been alumni of the school. So we're really so proud of the alumni. And for me, there's a very direct connection between alumni and prospective students, because
Hmm.
if you're a prospective student, actually what you are kind of buying into, uh, what you're committing yourself to, is to become a part of this incredible network, actually,
Yes.
of people. And
Hmm.
one of the areas that the school has improved on vastly in recent years is building a platform for our alumni to come together as a network and to really work together to solve these big challenges together. And we've seen, we've got now chapters all around the world, where alumni are coming together. I was really fortunate to be in different countries in the last couple of months and to met some of our alumni chapters who are coming together and sharing some really incredible work that they're doing. So I guess that direct link from prospective student to time spent with us to then becoming part of this incredible network, I think is so important, and a really nice way to close. So thank you.
Yeah, yeah. I mean, if there's one thing I would give the school is the ability to galvanize alumni, as you've said. And that's one thing I'm pretty much jealous about, being able to put together all your alumni. I know, like, occasionally my mate will pull out or will just show me a WhatsApp group where, there's every single big name in global health, and he's on a platform with them, and they are chatting, sharing opportunities. I think that those initiatives are really, really good. So hopefully the top programs in the US would also step up their game to make sure that when alumni leave their program, they are not, vanishing into thin air. They are bringing them together to kind of help prospective applicants expand their network. So thank you so much for joining us. It's been an amazing occasion or amazing discussion. I'll be following up for the links to the various programs, and I'm sure most applicants can find their way on the website. So thank you so much for being with us today.
Thank you.